I specialize in spine surgery and neuromodulation, where we use electrodes to manipulate the electrical signals in the brain and spinal cord to affect various disease processes like Alzheimer's, obesity, pain, stroke, and other debilitating disease.
What kind of results do you see with some of these neurological diseases that seem to be so difficult to treat?
Yeah, I mean, that's the problem. Drug therapy has a lot of side effects because it's very non-specific. You take a drug by mouth, it goes into your digestive system, it goes to your blood, it goes everywhere. It's almost like chemotherapy. It goes to your hair, it goes to your skin cells, it goes to your eye. It's very non-specific. When you neuromodulate, you put an electrode in the part of the brain or spinal cord which is causing the disease, so it only stimulates that small part. You get a good effect without all the side effects affecting other parts of the body. And so it was pioneered really for, originally for tremor, and we used to use destructive therapies where we burn that part, but then that's a one and done. It doesn't actually help or change after that one therapy is done. But with electrodes, you can modulate the therapy. You can have a programmer that'll change the stimulation current, so you can turn it on, turn it up, change the current, change the location of the stimulation, so you can get varied stimulation. If your disease changes, maybe 5 or 10 years later, you can use a programmer that'll then change that stimulation paradigm for the brain or spinal cord that'll affect that disease. So basically, you live with that chronic disease, but then you keep on battling it differently with the stimulation.
So with the stimulation therapy that you're speaking about, what's the maintenance like? Is this something that you do every day, or per episode, or how does that work?
Ideally, we don't want you to think that you have disease, so we don't want you to be using the stimulator or programming every day, because then every time you pull out that handpiece, you're reminded of the fact that, hey, I'm not normal. We want you to just program it and then be done with it, put it in your drawer, and then just be a normal person. Live your life, forget about it, don't take it on your vacation, just live your life, be with your family, and just be normal. In those small instances where you want to make a tweak with it, then yeah, just go to your bedroom dresser, pull out your stimulator, make some tweaks and you get full support with your representative and me. And as long as you make the right tweaks, then we want you to just put it away and just live your normal life after that.